Hi there, I'm Olivia, and this is my poster on iodine deficiency as a driver of PCOS-related infertility, and can supplementation improve outcomes? So PCOS affects 8 to 3% of reproductive age women, often causing infertility due to irregular ovulation. Many PCOS women have subclinical hypothyroidism, SCH, and it's possibly due to low iodine, which might worsen fertility by raising TSH and prolactin, TSH being thyroid stimulating hormone, which stops ovulation. So my research question is, does iodine deficiency contribute to infertility in women with PCOS? And can iodine supplementation enhance fertility by improving thyroid function and ovulatory health? So the goal is to see if low iodine is a fixable factor in PCOS infertility and if supplements can help women get pregnant by supporting their thyroid and their ovaries. So the literature review. Hatch, McChesney, and Lieberman say that low iodine causes SCH, subclinical hypothyroidism, which worsens insulin resistance, which is a very common factor in PCOS and is linked to poor ovulation. Witchell et al. Reported that ovulatory dysfunction in 70 to 80% of PCOS cases due to insulin resistance and hyperandrogenism, with SCH as a worsening factor, though iodine is not addressed in that study. Singla et al. found 22.5% of PCOS women have SCH with high TSH and PRL causing follicular cysts. Shakarian et al. And Fatima et al. Confirm SCH and PCOS increases HOMA-IR, which is a marker of insulin resistance, likely affecting fertility. Van Vegel et al. Found low iodine in hypothyroid patients, suggesting that low thyroid is a risk factor of SCH within PCOS, but no studies directly test if low iodine causes PCOS infertility or if supplements help. And so this little flowchart down here by Singla et al. Illustrates how primary hypothyroidism, which can result from iodine deficiency, leads to a cascade of hormonal changes that may impair fertility in women with PCOS. So it increases TSH and PRL, and leading to a whole cascade of hormonal imbalances that affect fertility and ovulatory health, which are all factors in PCOS. And so this flowchart is very central to my hypothesis that iodine deficiency by subclinical hypothyroidism may worsen PCOS-related infertility through disrupted thyroid, ovarian signaling, and yeah, and this conclusion by Singla et al., there is enough literature support to argue that prevalence of subclinical hypothyroidism and thyroid autoimmunity is increased in women with PCOS patients. The pathophysiological pathway and contributing factors behind this association are yet to be elucidated. Long-term studies are required to assess the significance of thyroid dysfunction in patients with PCOS, especially on fertility. So this conclusion really lays the foundation for my study using iodine supplementation to treat PCOS symptoms driven by SCH, improve fertility, balance hormones, and improve ovulatory health. So my methodology, I am using a 12-month experiment with 200 PCOS women aged 18 to 35 who've been infertile for at least a year, and low iodine confirmed with urine testing. It will take place at a local fertility clinic. We'll split them into two groups. One group receives 200 micrograms of iodine daily, and the other receives a placebo. For 6 months, we'll test thyroid function with blood tests for TSH, T3, and T4, insulin resistance with HOMA-IR, and we'll check ovulation using ultrasound and progesterone tests and track pregnancies with HCG. After 6 months, we'll discontinue the treatment and follow up for 6 more months, and we'll analyze by comparing the urine and the TSH and the ovulation rates between the groups, tracking changes over time, counting pregnancies, and looking for links between iodine levels and ovulation. This table here is an example of a table that I would use to show how the data would be used for the Pearson's correlation. And then some limitations here. So 12-month follow-up may underestimate pregnancy rates in PCOS. There are different types of PCOS, different phenotypes that could influence the results. For example, not everybody has cysts, not everybody has insulin resistance in PCOS. There are different forms of PCOS which could play a role here. Potential confounders if they're taking inositol or metformin for their insulin resistance. Limited generalizability, age, including age, secondary infertility. The urine test UIC alone doesn't reflect long-term iodine status. And then there's always a risk of iodine-induced thyroid dysfunction from the iodine supplementation. And the sample size of 100 per group is a somewhat small sample size. So this study will show if low iodine and SCH are common in PCOS women and cause infertility, and if supplements can help them get pregnant by fixing thyroid and ovulation issues. So yeah, thank you for watching, and here are my references, and I forgot to delete that one graph there. But yeah, thanks for watching.